you, Mr. Sandeep Peters. Thank you, Dr. Mridul Sahani. Thank you, Dr. Jidesh Sharma. And now it's the time for the international session, and it's a 1046th day of uninterrupted daily webinar of Ifph. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy and lovers. Today is the 1046th day of uninterrupted daily webinar of Ifph. And today our guest is Dr. Girish Gupta. He's an MD and Ph.D. He's the Chief Consultant of Government Clinic and Center for Homeopathic Research. Excuse me, there's some...
Galaxy.
बहन लाई थी बकरा तो क्या याद आता दीदी से हमने कहा था तो मत करो हम तुमको चॉकलेट दे देते तो इसकी लाठी दिए तो ले ही रहा है
खूब चॉकलेट बस हाँ
Today, our guest is Dr. Girish Gupta, and he is the Chief Consultant of Government Clinic and Center for Homeopathic Research. He is the President of the Homeopathic Research Foundation, HRF, International President, Asian Homeopathic Medical League. He is the member, Editorial Advisory Board, Indian Journal of Research in Homeopathy, IJRH, published by the Central Council for Research in Homeopathy, Government of India. He is a member, SAC, CCRH, Ministry of Health and Family Welfare, Government of India. He is a member, Special Committee for Human Pathogenic Trial, CCRH. He is a member, Governing Body, National Institute of Homeopathy, Kolkata. And he is a member, Editorial Advisory Board, IJRH. Member, Editorial Board, Advancements in Homeopathic Research, Noida. He do have research assignments as was research co-investigator in a scheme entitled Screening of Homeopathic Drugs in Animal and Human Viruses, sponsored by the Central Council for Research in Homeopathy. Was principal investigator in a clinical research project of 3-year duration from August 2006 to September 2009, entitled To Involve a Group of Most Efficacious Homeopathic Medicines in Benign Prostate Hyperplasia. Was principal investigator in a clinical research project for 2-year duration, entitled Evidence-Based Clinical Study on the Effect of Homeopathic Drugs in Cases of Ovarian Cyst, funded by Department of Ayush. He is the principal investigator in a clinical research project for 2-year duration, entitled Evidence-Based Clinical Study on the Role of Homeopathic Medicines in Cases of Polycystic Ovarian Disease. He presented various scientific papers published in national and international journals, more than 80 clinical research papers on various subjects, published 2 books entitled Evidence-Based Research of Homeopathy in Gynecology, Evidence-Based Research of Homeopathy in Dermatology, Experimental Homeopathy. Awards and prizes: National Youth Award, 1986. International Gold Star Millennium Award, 2003. Kamal Patra Award, 1990. Prakriti Ratna Award, 2005. And International Handyman Award, 2018. Mahendra Singh Memorial Best Scientist Award, 2017. Jewel of India Award, 2002, 2020. Dr. R.P. Singh Memorial National Award, 2016. Mother Teresa Excellence Award, 2002. And let's welcome the eminent faculty for the day, Dr. Girish Gupta. And the subject for today is Evidence-Based Homeopathy in Cases of Uterine Fibroids. Just a minute, I need to make him in the co-host. Dr. Girish Gupta, you can start the session now. You can unmute yourself. Oh.
Hello.
Hi, sir.
So good evening to all of you, sir. Am I audible, sir?
Yes, yes.
Okay.
Start.
So good evening to all of you doctors, respected Dr. Sani and all participants, doctor who is presiding this session on uterine fibroids. So let me first thank all the members of International Forum for Promoting Homeopathy for permitting me, allowing me to present my work for the second time in front of you all. So let us come to the topic, very, very important topic of the day, role of homeopathy in uterine fibroids. The screen is visible to all of you, Doctor?
Yes, yes. It's visible.
Okay.
Next, previous.
As we all know, that uterine fibroid is a surgical condition as per point of view of modern medicine. There is no drug available in any system of medicine so far except homeopathy. So without wasting time, let us come to the topic. This work we have done at Gaurang Clinic and Center for Homeopathic Research. This is situated in the capital of Uttar Pradesh, Lucknow, in Kapurthala. This is the first research institute in private sector of its kind, established by us in 1995. This is the premises, the building of our clinic cum research center, where we are working for the last many years. As we all know, uterine fibroids are benign tumors derived from connective tissue of uterine wall. Women with low parity are more prone, and menorrhagia and metrorrhagia are the presenting symptoms. Usually profuse bleeding or intermenstrual bleeding, and sometimes very severe pain, that is dysmenorrhea in lower abdomen of a lady, are indicative of fibroids. There are various types of fibroids depending on their location. Number one is subserosal, which develop in the outer portion of the uterus and grow outward. Submucosal develop just under the lining of uterine cavity inside, and intramural are found in muscular layer, muscular wall of the uterus. For diagnostic point of view, they hold some value, but from treatment point of view, it doesn't make any difference whether fibroid is subserosal, submucosal, or intramural. Now, how the basic process is how to treat such cases. There are two types of approaches. One is to treat the fibroid as per nosological diagnosis, as per local sign and symptoms of the fibroid, where you can prescribe organopathic drugs. But the basic philosophy which our master has enunciated in Organon of Medicine is to treat the person in disease. That is holistic point of view, not the disease in person. Meaning thereby, we have to treat a person, lady, having fibroid, and not the fibroid per se, which a lady has. So it makes a lot of difference in thinking, in taking up the case, and in treating and selecting the remedy. So here we have to individualize the case from holistic point of view and then prescribe a remedy to treat cases of fibroid. Just in consequence, in the line of homeopathic philosophy. So we should not compromise with the philosophical aspect, basic tenets of homeopathy, just to treat person as a whole. Now, the question is how fibroids are formed. So the pathway of genesis of gynecological diseases vis-a-vis pathway of action of medicine, meaning thereby the fibroids are formed, of course, in the uterus, but uterus comes under the command of ovarian hormone, that is estrogen and progesterone, which in turn is affected, controlled by pituitary in the brain. Pituitary produces luteinizing hormone and follicle stimulating hormone, which in turn affects ovary and ovary affects uterus. Now the question is how these signals goes in the pituitary gland. They come from hypothalamus and higher centers of the brain. So this is how any disturbance at psychological level affects your pituitary, hypothalamus, then pituitary, then ovary, then uterus. So the drug action should also follow the same pathway as the fibroids are formed. That is very well established psycho-neuro-hormonal axis, psycho-neuro-endocrine axis, meaning thereby you have to take the person's mental sphere symptoms and her life space and emotional factors into account, then select a remedy which will act through this axis from mind to brain, then pituitary, then ovary, then uterus. So pathway of drug action should always be the same as the pathway of genesis of fibroid. This is, we have to keep in mind. Now there are, since mind is very, very important, and Hahnemann, our master, was the first person in medical history who 200 years ago wrote in the Organ of Medicine that disease process is initiated in the mind first. Then it goes in the body through various channels. So various common factors, causative factors, which should be considered for case taking are suppression of anger, grief, death of loved ones, disappointment, mental shock, insult or humiliation, sexual abuse, deception of any kind, various care and worries, ambition deceived due to various reasons, fright, fear, anticipation, financial loss, and indignation. These are various factors which affect a person emotionally, and mind is affected. Psychology gets disturbed, disordered. So these factors could initiate hormonal changes, neurohormonal changes in the body through psycho-neuro-hormonal axis. Various dreams are very, very important. Thanks to homeopathy, this is the only science where importance to dream and various delusions is given importance compared to other systems of medicine. So here, various dreams like religious dreams, anxious dreams in general, dreams of dead relatives, and dreams of death of relatives, both are different. Dream of dead relatives and death of relatives, very, very important. Dreams of unsuccessful effort, meaning thereby a person is trying to do something and not able to do it. So unsuccessful efforts. Dreams of quarrel, fight, very frightful dreams. Dreams of ghosts. Dream of flying. Dream of falling from height. Dream of accident. Dreams of various animals, particularly snakes. They affect your mind very, very badly. Delusion of someone behind and delusion of snakes. There are various delusions, but we have kept only 2 delusions over here, which are usually encountered by us in clinical practice. So for each and every dream, can you believe we have got a remedy? So if a dream is affecting the person emotionally, psychologically, then it should be considered as a very, very important prescribing symptoms. If we have got this topographical sketch, diagrammatic sketch, in which various factors which affect mind in some way or the other way are, first of all, if you take delusions, delusion of being poisoned, delusion of snakes, very, very important. We are encountering patients who have got delusion of snake even in the daytime, not at night, but even in daytime, in the chamber itself. They say, I feel as if snake is hiding somewhere. And delusion of someone behind. A person just have got a delusion that somebody is following, somebody is standing behind. It causes fear in the mind and affects your mind. Financial loss is very, very important factor. Now dreams, as I told you, there are various types of dream: falling, frightful, dead relative, unsuccessful effort, animal, water. There are umpteen number of dreams which affect your mind, which should be taken care of during prescribing and selecting a remedy. Then various fears, very, very important: fear of dark, fear of cancer, fear of water, fear of misfortune, fear of death, fear of, as if something wrong is going to happen, fear of death, fear of cancer. Fear of cancer is more dangerous than cancer itself, because a person starts feeling bad about the disease in mind the moment she or he is diagnosed as patient of cancer. Before that, without knowing that he or she is suffering from cancer, one lives a happy life. So these are various fears which affect our mind and should be taken care of during taking up the case. And the most important of all, above dream and delusion and fear, are the causative factors, causations, which Dr. Henneman has given top priority and importance in selecting a remedy. So various causations like disappointed love or friendship, mortification, various prolonged torture in the family by family members, grief, insult, anger, shock. Suppressed anger also affects your mind, and mental shock, financial loss. So these are various factors which affect your psychology emotionally, and they form a signal in the mind and initiate a neurotransmitter secretion. Neurotransmitters are nothing but neurochemicals which are secreted in the brain, and they affect the pituitary gland through hypothalamus. So from here, from software to hardware problem starts forming in the body. This is below pituitary. What happens below pituitary gland? So now these psychological factors, they cause external stimuli, secrete neurotransmitters, and they affect hypothalamus. From hypothalamus, signal goes in the pituitary, that is anterior pituitary and posterior pituitary. So pituitary hormones get disturbed, imbalanced, leading to their changes in corporeal body, that is physical body organs like kidney, breast, uterus, bone, adrenal gland, ovary, testes, and adrenal glands, of course, and ovaries. So these changes in the pituitary gland makes a turbulence in hormone system, which in turn affects your body organs, even including thyroid. Like TSH, if TSH is disturbed, it goes high, then hypothyroidism takes place. Likewise, if LH and FSH is disturbed, it affects your ovary and uterus. If prolactin is disturbed, it affects breast. So likewise, testosterone, if that is affected, then it affects the testes. So from psychological aspect to neurological aspect, then endocrine aspect, and coming in the body. So this is the total pathophysiology of changes that takes place in the body in the formation of uterine pathology, including fibroid and ovarian cyst. Now comes to homeopathic philosophy. Why Dr. Henneman gave more most importance to mentals? Because mental general is more important than a physical general, and physical general is more important than a particular symptom. So this is just a hearsay that one mental general can rule out several physical generals, and a strong physical general is more valuable than particular or common or pathological symptoms. So keep in mind, while selecting a remedy, we have to give top priority to mental journal, then physical journal, and least priority to particular symptoms. And only removal of diseased pathological organ cannot annihilate the disease in its entirety. It will manifest in some other organ unless the cause is removed. What happens? You must have seen that if uterus is operated, fibroid is removed, something, it may recur again in the uterus. If entire uterus is removed, sometimes pathology goes to ovary, ovarian cyst takes place. If ovary is removed, another ovary is affected. So you are just targeting, annihilating the diseased organ, not the cause of the disease, which lies in the psychoneurohormonal axis. So we have to keep in mind all these things. Now about potency selection, we usually start the treatment with indicated remedy in basic, that is 30 potency. In case of no response, we go to 200 and 1000. However, in a few treatment cases, treatment was started with 1000 potency in a few cases. 30C is considered to be low potency, of course, but it is very high dilution above Avogadro number. As far as Avogadro number is 30, is very, very high dilution. But to homeopaths, 30 is a low potency. So Similimum will work even in low potency. If the drug is not well indicated, it is not going to work even in any potency, whatever, 50 mcm, it is not going to work. So you have to have Similimum based on mental and physical journal, only then drug will work in 30 potency. Now, quickly coming, because we have lost 25 minutes. So coming to a model case, I'll be presenting 2-3 cases. Quickly, Mrs. SD, registration number is given, fibroid number is 1197. A 40-year-old multiparous, gravida 5, parity 4, female patient came for treatment of uterine fibroid on 5th January 2020. Menstrual history was profuse, long-lasting, clotted, and painful. Father was diabetic. She came with this ultrasound. This is a posterior wall myoma, fibroid, measuring 40.4 into 41.4. It's almost 4 centimeters, quite a big fibroid. So we started taking the history. So this is very important life space. Her elder sister died in 1994. She was very much attached to her and shocked due to her untimely demise. She used to visit to sister's house quite frequently to look after the nephew, who was only 2-year-old at that time. This was just a life space. 2 years later, in 1996, she got married to sister's husband under family pressure to take care of studies and upbringing of her nephew. She was in profound grief that her nephew, now aged 28 years, for whom she sacrificed her whole life, is very careless about his career and family. This was the story. She revealed that from inside, I am grieved because I sacrificed my life for this child, and he is very, very careless. So with these causative factors, we took up the history. It was a long history, but we are just showing you the rubrics. Ailment from grief, she was sad from inside. Ailment from suppressed anger, she was not expressing. She became pessimistic, was very sentimental. She used to weep easily when alone, forgetful, persistent thoughts in the mind as to what is going to happen to her life and to child life. Then anxiety about trifles, some frightful dreams and anticipatory anxiety as to every time she was thinking what is going to happen to this son of my sister for whom I sacrificed my life. So these are the rubrics. We put it for repertorization with the help of Compass software. And this is a repertorial chart. So the result of repertorization was natrum mure covered 13/13 symptoms and coverage. Aurum met 10/13, calcarea 10/13, and ignatia 10/13. Thermally, she was hot, but the hot or chilly is a physical symptom. But we also gave importance to this. So, natrum mure, aurum, calcarea, ignatia were shortlisted out of 595 medicine from repertorial analysis. Among these, we selected natrum mure on the basis of high-grade mental symptoms like ailment from grief and weeping when alone. Not better by any consolation because she sacrificed her life. She got married to her brother-in-law for the sake of taking the care of child who was very, very careless at that time. So these were the two most important crux and nuclear symptoms in her personality. So we selected natrum mure and we started the treatment on 5th of January 2020. So natrum mure 30, single dose once a week, followed by placebo. Sabina 30 SOS during profuse menses because she was taking some anti-hemorrhagic remedy of allopathy. So we asked her to take Sabina 30 during periods if the bleeding is profuse or very painful. So she reported on 9th February, patient was better. So same prescription was repeated. So 29th 4th, 2020 message appeared. She reported message appeared on 19th March and 28th April. Were regular but profuse and clotted. So same prescription was repeated again. So patient was better than before. On 6th July, she reported she was much better. And mentally also she was very happy and her grief also came down and she was very, was able to talk to us in a very positive manner. So we advised for ultrasonography. So ultrasonography dated 14th September 20 revealed anteverted bulky uterus measuring 96 into 50 into 54 with normal uterine myometrium. Here is the ultrasound. And you will see this is a normal uterus. No fibroid, not even a trace of fibroid would be detected. On your left side, you will see just excess of gases in the abdominal cavity, bulky uterus, but no fibroid is seen in this report. If you compare on your left side, you will see posterior wall fibroid, very large fibroid is seen. And on the other plate, you will see yourself normal uterus. So fibroid, this is a comparative report of Kashish Diagnostic Center. And the other report is also from the same center from where she got it done initially. And the status is cured. So it took about 8 months and few days. And she was cured by a single remedy of homeopathy, that is natrum mure, 30 potency, and SOS medicines, of course, like Sabina, etc. So case was saved from surgery. Now coming to the case number 2 quickly. Chief complaint, Mrs. RR. Here is the fibroid number 885. A 42-year-old biparous female was having painful menses for the last few months. She was having some acidity and anasarca, dullness, and very indolent, very indolent lady with puffiness on the face, in the hands, and in the foot, both feet rather. She was having history of migraine and some skin lesions for which she used to use some ointments and used to take painkillers. But she came to us for treatment of fibroid. This is again a very large uterine fibroid, 49.9, that is 50 millimeter, and 54.9, that is about 55 millimeter. So this is a large fibroid with some Nabothian cyst also in the cervix. It was subserosal fibroid. You can very well visualize in the ultrasound picture. It's a very large fibroid in the uterus. Now coming to the rubrics, because this is a long story, long history. So to cut short the time, she used to get angered very easily. she was having anger from contradiction, very, very dull, very sust, very dull lady, aversion to work. She was feeling like lying down all the time, fear of high places, fear of snakes, delusion of snakes. Please mind, she used to have delusion not only at night but also in the daytime, as if a snake is somewhere and it might bite her. And she was that time, even fear of a snake was so much she could not see a snake on the screen of a television or in the newspaper. She used to just throw it away because of fear. Confusion of mind, she was very much confused, irresolute. She used to forget things very easily. Dreams of unsuccessful effort. She used to dream that she is going to examination hall, not able to reach there. She is writing, when it is reached, she is writing, ink is finished, copy is finished, and she is not able to complete the answer sheet. So this kind of fear, dream, she used to see during sleep and used to get frightened. Tendency to catch cold, this is the physical general, aggravation from cold of course, perspiration, both palm and sole. This is again a physical general. So from mental general coming to physical general, and thirstlessness, this is again a physical general symptom. This was a picture of a lady, not of the fibroid. And we have taken these rubrics for repertorization process. This is a repertorial chart in front of you. And quickly coming to the result of repertorization, that is Calcarea car was at the top, sepia, naxomica, natrum. Here is the coverage. Thermally, she was a little chilly side, but ambithermal. But she was not, well during winters. But she used to like air conditioning during summer. So we were not sure whether she is chilly or not. So it is ambithermal. Now the rubrics, why we selected a remedy on what basis? Rubric, fear, delusion of a snake, very, very important. Dullness, indolence, confusion of mind, forgetfulness, sweating palm and sole, and tendency to catch cold were in favor of Calcarea car. In sepia, you don't have delusions of a snake. Sepia has got a fear of, dream of a snake, but no fear of a snake, no delusion of a snake. Sepia is not dull. No, she is not dull and she is not confused. So with this symptom picture, holistically, Calcarea car was considered by us as a simillimum. So from April 13th, 2014, we started with Calcarea car 30, one dose prescribed once a week, followed by placebo for 4 weeks. She reported on 19th May. So she said message appeared on 1st May, flow adequate but painful. Delusion of snake still persists. Calcarea car 30 weekly, followed by submissive yoga twice daily for 4 weeks. Why? Because she was having dull aching pain in the back and in lower abdomen, and she used to have menorrhagia and used to have some painkillers during periods. So we asked her not to take painkillers and take submissive yoga for 4 weeks. On 23rd June, she reported, so pain reduced. So we repeated Calcarea car once a week, followed by submissive yoga again, because she was better with submissive yoga. On July 25th, she reported to us that message appeared on 12th July 14. Flow was normal, pain much reduced. So here we did not give submissive yoga, but continued with Calcarea car 30 once a week, followed by placebo for 4 weeks. Patient was advised to go for repeat because clinically she was so well. She was better clinically and generally also. So she was advised ultrasonography or TVS. On 26th August, she came to us and reported that flow was normal, pain was not there, swelling all over body much reduced, even the anasarca reduced, and surprisingly mentally she didn't have delusion of a snake. This was the best part of the story of this lady, and TVS we advised transvaginal sonography dated 23rd 8/14, which revealed complete resolution of fibroid. Here is the follow-up report of the lady. This is Ranjana Rajput. Yeah, chronic cervicitis she is having, and it a little follicular cyst, but the uterus became normal, and the patient was considered as cured. She was saved from surgery. Here you see the large fibroid in the uterus in left side, and in the right side it's a normal uterus. So we considered this lady as cured. It took about 4 months and few days, and patient was much better. But this case was further followed because of remaining cervicitis and some follicular cyst in the ovary, which was not pathological anyway. It was just a physiological follicular cyst, but treatment was continued for some more period, and follow-up ultrasound, I don't remember whether she got it done or not. She might have left the treatment on her own, but thanks God that she was saved from hysterectomy or removal of the fibroid from the uterus. Now coming quickly to case number 3. 43-year-old, this is fibroid 787 number. Uniparous female reported on 24th May 13 for treatment of prolonged profuse periods. She was advised ultrasonography. Gallbladder was removed 1 year ago. Her father suffered from carcinoma of kidney, and mother also suffered from carcinoma of gallbladder. So she was very much afraid of impending cancer in her because both parents suffered from cancer and they died of that only. So she came with multiple fibroids. You see in the report, enlarged uterus due to multiple fibroids. Here, the bigger size of the fibroid was 59 into 42, 33.5 into 26. So it was 6 centimeter into 4 centimeter and 3.5 centimeter to 2.5 centimeter. This was a challenging case, of course, but we took up, and I'm leaving the story behind and coming to the the rubrics directly. So the rubrics we taken out was fear of being alone. She could not live alone. She always wanted company. She had fears of snake, anger easily, shrieking during anger, too much of anger. She was obstinate by nature, dictatorial, very impatient, hurried, ammoderation from consolation, weeping easily. She was very emotional. At the same time, very obstinate and impatient. She was all the time asking whether, doctor, am I going to develop cancer? Or will I be cured? Will I be saved from surgery? So these are so many questions. So she was very impatient, but very emotional, weeping easily. Fear of narrow places, that is claustrophobia, desire for company, desire for fish, perspiration, and palm. So this was a picture depicted in the story of her history. We have we reported from the same Homeopathy software and found Lycopodium, Nux vomica, sepia, pulsatilla. Patient was thermally from Chile side. So we selected Lycopodium. There were so many drugs which are confusing. Sometimes it was looking like Natramure, sometimes it was looking like Pulsatilla, but the most dominating thing was impatience, anger suppression, shrieking during anger, and very dominant lady. Though emotional, but very dominant. And the rubrics: fear of being alone, anger easily, very dictatorial, impatient, weeping, fear of narrow places, claustrophobia. Claustrophobia is also in Pulsatilla, but it is found in Lycopodium as well. And anger from contradiction. They were in favor of Lycopodium, not Pulsatilla, because she was very dictatorial, impatient. And she was better by consultation. So it was not Natramure also. So we considered Lycopodium. This was a very difficult decision, but we took up the case and selected lycopodium. So quickly we started with lycopodium, single dose once a week, followed by rubrum, that is placebo. On June 12th, she reported she was better. So lycopodium was continued, and there was no other remedy that was needed for prescribing. On August 22nd, she reported that clinically she was better, and we advised ultrasonography because of keeping in mind the clinical improvement in the patient. So on 19th November 2013, she reported to us, and reporting that message appeared on 5th September through prolonged but lasted for a week. And ultrasonography she brought in was dated 28th of October, revealed a normal uterus with no evidence of lesion. Here is the normal uterus. You will see post-cholecystectomy status, and other visualized organs are normal. Uterus has become normal. Here is a comparative ultrasonography report, pictures. In the left side, you see uterus is enlarged, having multiple SOL, space occupying lesion. On the right side, uterus has just become normal. You see, compare both the pictures, uterus has come to the normal size, and there is no trace of fibroid whatsoever. Here are a comparative report. On the left side, enlarged uterus due to multiple fibroids. On the right side, you will see just gallbladder is not visualized and other organs are normal. So thanks to this lycopodium in this case, that it was a really simillimum to the case, and patient was cured. So last but not the least, I was tempted to include this case today only. Very quickly, a 40-year-old, this is fibroid number 13, 1311. A 48-year-old overweight biparous female with hypothyroid came to us just on 16th of May, 2023, 3 months ago, for the treatment of fibroid. Father was diabetic, hypertensive. She was on thyroid for the last many years. Here is a very, very large fibroid, and patient had 2 cesarean operations. Hence, she was reluctant for surgery. I suggested just 3 months ago, I suggested that please you go for removal. This is a very, very large fibroid. But she said, no, doctor, I would like, because she was referred by some patient who was cured of this problem. So she said, now I'll give you 3 months. Okay, we took up the case. So quickly, she had a strained relation with her husband. This is a personal history for the last many years, and got offended easily over petty matter. She had persistent thought anticipating misfortune. She remained sad, used to weep when alone, and got irritated when someone tried to console her. Later, she developed pessimistic approach. She had liking to salty food. What happened? She developed some suspicion about the husband, as if he is having some extramarital affair. I have not included in this, but this was the story. So she was aggrieved from inside, and this was a tip for us to prescribe a remedy. So these are various rubrics. It was repertorized. Coming to the next, we selected, patient was hot. We selected Natramure because of anticipation, desire for solitude, aggravation. She was not liking consolation, offended easily, persistent thoughts about the character of husband, weeping easily when alone, pessimistic, sad, and desire for salty things in favor of Natramure. So we selected Natramure, started the treatment on 16th May, just 3 months ago. Out of curiosity, we gave it the medicine for 6 weeks because she was going out, she wanted for 6 weeks. We said, okay, you come to us for next prescription. So out of curiosity, on the second visit only, she got ultrasound done without our consent. And on July 12th, that is today's 13th July. Yesterday, she came to us with the ultrasound dated 3rd July, it showed 30 to 40% reduction in the dimension of fibroid from 63 into 58 to coming down to 42 into 33 millimeter. Yesterday, she reported to us, so we included this case today only just to show you how quickly an indicated remedy can work. So we have prescribed the same prescription for another 8 weeks. She has gone yesterday with this prescription, and she would come 2 months later with next ultrasound. So here you will see it has come down, the size has reduced, the status is improving. Here you can compare very large fibroid, 63 into 58, and it has come down to 42 into 33. About 30 to 40% reduction in the size of fibroid within counted 45 days of treatment with natramure, nothing but natramure. So here is a comparative report. Those shows reduction in the fibroid, and I am again showing you the original case sheet. This is how we document a case. This is the patient's name, and registration number is printed on left top of the case sheet. On the right side, you will see in a box 5023 number. This is her case of pelvic tumor. We are maintaining pelvic tumor file separately, including ovarian cyst and fibroid. So it is 5028 number. We have documented so many numbers in the last maybe 25 to 30 years. And here on the with the red block, you will see fibroid 1311. This is a follow-up number. Those patients who were well followed up are 1311. We are maintaining the register separately and software separately. Here you will see a short history of the patient and the prescription natramure 30, 12 doses and 3 doses once a week, followed by rubrum and phytium. And on the second week, it was given for 45 days. And here you will see ultrasound of pelvis on 3rd July 23, fibroid measuring 42 into 33, improving. And not only that, you will see her TSH has come down from 7.2 to 5.5. So this is the original case sheet I wish to show you as to how we are documenting cases and taking the history. On the right side, this is the patient's consent form, because we are maintaining documents, we are maintaining records of all such cases. On the right side, here is signature signed by the patient or attendant, and this is a consent form we are maintaining in such surgical conditions where it is risky to continue the case. So with this slide, I would like to switch over to the result of our study. I think time permits. So this is a story of 630 cases of fibroid. Out of them, complete resolution we have found in 214. It comes to around 34%, and in 201 cases, patients showed improvement in size of fibroid. It comes to about 32%. If you club up, it's about 60% plus. Coming to the conclusion, all types of fibroids we have treated, subserous, intramural, submucous of any size, whether small, medium, or large, can be resolved with homeopathy. And very large, calcified, and multiple fibroids filling the entire uterine cavity are difficult to cure and may require surgery. If uterus is full of fibroids, or it is calcified, or it's very, very large, maybe 8 centimeter, 10 centimeter, we have not been able to cure any fibroid above 6 to 7 centimeter of size. So this is a limitation that we should avoid treating calcified fibroid and multiple fibroids filling the uterine cavity. This is very important to note, various disease-specific patents and combinations being sold with the name of fibroid drops, etc., fibroid compound, cannot cure If somebody has cured, I invite with folded hands to come forward to give a lecture, presentation on this platform if someone has cured with any combination or specific remedy. These are being sold in the market. But I have not seen a single case having been cured with these patent drugs. So please keep in mind. Organ-specific remedies, mother tinctures, can give symptomatic relief, but have no effect on fibroids, like Sabina, Simicip Yuga, Thlaspi, Calcarea iodide, Fraxinus americana. These are the remedies which may give relief in symptoms, in dysmenorrhea, polymenorrhea, menorrhagia, but they do not resolve the fibroid. This is our experience. Only remedies selected on holistic principle, as I enunciated in the beginning, as enunciated by Master R. Henneman in the Organ of Medicine, that too, in potentized form, is effective in the treatment of fibroid. No mother tincture can cure fibroid. If somebody had done, one is welcome to publish or to present in such platforms. We have published this paper in Asian Journal of Homeopathy in 2011 on the role of homeopathic ultrasound-based clinical study in cases of fibroid. And the other paper that was published was in Homeopathic Heritage, and you will not believe this was peer-reviewed by the authors, authorities, evidence-based study on the effectiveness of homeopathic medicine in large fibroid. Here you will see the cover page was designed for this purpose only. It is showing pathology in the uterus. Just to show you, this is our documentation, this is our data bank, this is how we are maintaining the records of research value. Here you will find uterine fibroid, file number 119, fibroadenoma, ovarian cyst, fibroid. So this is how we are maintaining the records in our data bank separately, other than outdoor, just to take out, to derive the conclusions and to write the papers and to prepare presentations like the one I'm presenting in front of you. So on the basis of this, you'll be glad to know that we have published a book, Evidence-Based Research of Homeopathy in Gynecology. I have dedicated this book to Dr. Girish, who established the first homeopathy university at Jaipur. He was my guide in Ph.D., in MD, and he suggested me to write a book in due course of time. So with his blessings, I have been able to write this book. This is in front of me, and it has got 6 topics, including uterine fibroid, ovarian cyst, PCOD, fibroadenoma of breast, Nabothian cyst, and cervical polyp. So this book is of utmost importance for the researchers who are doing MD or PhD, or to clinicians to take help of prescribing good remedies for such conditions. And this book can be had by Amazon also, or somebody can scan and get the book if somebody desires. So with these words, I am sorry to have taken 55 minutes, but this is the best what I could do as far as time constraint is concerned. So with these words, I just thank you once again for all the authorities of International Forum for Promoting Homeopathy, including Dr. Sani. Thank you very, very much. Very, very much. Thank you.
It's a great session. Thank you, Doctor. Very informative and sticking to the cardinal rules of homeopathy. That's a great thing. And wonderful results yielded from this way of approaching the cases. And it's a time to interact with the speaker, and only only 4 minutes. And it's very less, I know, but it was a very informative session. And first is Dr. J.D. Daryani. Doctor, you can unmute yourself.
Dr. Girish Gupta,
Sir.
heads of you. Heads of to you. Really, I am very impressed. You asked me, will you attend? I thought this I will depends upon my availability or whatever. Then I put that for short while I will attend, means half an hour.
Yeah.
And you asked me, do you treat the fibroid cases? I said no. Why? Because the lengthy process.
Yeah.
But it is an eye-opener. Your way of finding the simillimum, that is very important and very considerable and very knowledgeable. It is rather, you are the torch bearer of homeopathy, evidence-based.
Thank you, sir. Kyani Sahab, namaskar.
Thank you, Dr. Dharyani. And next is Dr. Dhanesh.
Good evening, sir. It's a very nice process.
I'm not able to hear you.
Sir,
Doctor, please.
sir, video I cannot play.
Okay, then you
It is
can.
locked. It is locked, sir. Yes, sir. Sir.
Now I can listen you, but I can't.
It's a very nice presentation. And you proved that homeopathy can do this much of wonders with our medicines. And
Definitely.
all the cases you presented were really excellent, and nobody could believe that homeopathy can do such wonders for getting such disease cured. Supposed to be surgical cases, but we homeopaths in Kerala also doing lot of works in this area, and there are doctors who have produced brilliant result in this area. This is how homeopathy is being propagated among people, and we are proud to have such doctors like you in this way, taking all steps, precautions to say through the world that this is effective, and your research study and your methodology and everything is fine, sir. Congrats for your excellent presentation once again. Hope we can have one more presentation as early as possible, sir.
Okay, thank you, Dr. Dhanesh.
Thank you. And it's the time to conclude the session. And I appreciate you, doctor. It was a very motivating class. And on behalf of Ifph, I am paying a lot of thanks to you. And for all of the members here, thanks. And over to Malayalam for the session.